Morning Instagram, my name is Jack O'Connor. I'm working with MSD Animal Health. All this week we're bringing you a day in the life of a vet campaign. Essentially we're going to follow around a vet for a full day to understand what their day looks like, what kind of work they do, clients they meet and so on. We're delighted to be partnering with XLVets Ireland for this week, and now I'm on my way down to County Kilkenny where I'll be joined by Kieran Devaney from Ormonde Veterinary Hospital.
My name is Kieran Devaney. I'm from Ormonde Vets in County Kilkenny. We're a mixed practice covering, mainly based in Kilkenny City. That's where our hospital is based, and we've got two branches in Thomastown and Callan. So we're fairly busy morning lined up. We'll be back at base later on, and we'll try and get a look at a few things then. I'm going to look at a cow here this morning. She presented with milk drop. Farmer has activity monitors, and rumination has been down for the last 12 hours. And she woke up this morning a little bit hunched up and cold in herself, so we'll just see what's going on. See this cow, as I say, presented this morning with milk drop. She's a bit cold in herself. So this cow was chilled overnight. She had a scour yesterday evening, and that's led to her having poor rumen function, rumen movement overnight, and she's just become chilled. And this morning she's down, cold, hypothermic. So we're going to treat the scour, but firstly we're going to try and warm her up. So we're going to pump in oral fluids. We'll check in with her again later on, but more than likely she'll be up and going later on when she turns around. So it's an antacid for the scour. We're giving some electrolytes causing the scour, just have a dehydration, and some glycerine for energy. So we saw that cow there. She most likely just got chilled overnight. She had a bit of a scour yesterday, poor rumen fell and got a chill overnight. So we'll get an update from the farmer this evening, see how she's looking, but most likely after the fluids and the treatment she received, she'll be cracking along later on. He presented us with a second cow, calved 30 days, and she has left displaced abomasum. So she's not really performed since she calved down. So the farmer is going to weigh up whether or not it's worthwhile going ahead with the surgery, or whether we might need to, he may just cull her. And that's probably, if she's going to be an unproductive cow for the rest of the year, the likelihood is that she'll probably just get culled now and fattened. He also had two calves, just with nutritional scours, dietary upsets. He's just at the end of calving, two cows left to calve, and these are the last two calves born, and just slight nutritional scours, nothing infectious. The herd's fully vaccinated against the common types of scour that we see. So he uses Rotovac Rona, and cows are fully covered. Calving has gone fine, no scours all spring, no pneumonia issues. His purpose-built calf house there, that's really just doing really well. He keeps all his own replacement heifers, no pneumonias, no scours, a really well tidy run operation. This is our second call where it's a routine visit. We're just taking some pre-breeding bloods just to check trace element status of this herd before breeding starts. It's a 220 cow Holstein Friesian herd, and we also have a sick cow to look at here as well. Calved about a week and off form, has retained her cleanings. On the last farm we had a look at a cow that had retained cleanings. She's very routine, so she should be okay. We just started her on antibiotics now. She was running a temperature, and we took bloods from 6 cows as part of an XLVets SkillNet Ireland mentor program, a mineral mentor. And the idea there is to just check trace element status pre-breeding. We try to encourage most of our herds to do that just prior to breeding. So if there's any supplementation or anything that needs to be added, we try to do that pre-breeding. And again, we also would encourage farmers to do that maybe halfway through breeding, again, just in case there's any change. We'd like cows out and probably at grass 2 weeks when they go to do that. We also looked at some calves that have been turned out to grass that are starting to scour and go backwards. So we'll get dung samples from those. We'll check to see if there's an issue with worms. So they're on a paddock that yearlings have been out on already this year, and we'd also maybe be concerned about summer scour syndrome already. So that's something we'll look at, and probably take a mineral mentor for those calves tomorrow and check trace element status as well. So we're just here wash out 2 cows. These are 2 cows that are just going to get some literature. They pre-breed scanned last week and were just found seem to be dirty. So they were given estimate 48 hours ago, and we're just going to wash them out now. Okay, so we're just on a farm now, and we're just going to put these heifers on a synchronization program. It's an 8-day program for fixed time AI for these heifers. They'll have their progesterone devices put in today. They'll be given a shot of GnRH, and then it's an 8-day program in total. In 5 days' time, they're going to get prostaglandin injection. They're going to get a second prostaglandin injection 24 hours later, and they're going to have these cedars taken out at that time. Okay, on this call we're just going to look at a goat that we saw last week. This goat had pneumonia last week, so we're just giving it another injection today. Now, it hasn't been thriving very well for the last while, so we're going to take some dung samples, maybe to check for a disease called Iones, and check and see if there's been a history of that here previously. So we're just after looking at a cow there, and she has a joint infection, fetal joint infection, starting to burst out. So we're going to try to help it drain now. So we're going to apply a poultice, and we're going to put on some vet wrap, and she's starting on an antibiotic and an anti-inflammatory for the next few days. It should hopefully be fine 3 or 4 days time.
Kieran, we've been out on farm since about 9:30, 10 o'clock this morning. Loads of different cases and loads of different things presented to you. Would this be typical of a day in the spring for you?
This would. Maybe there's some more routine things booked in today just because of the time of the year. Most of our herds are predominantly calf now. We just maybe have a few stragglers left. We're probably into the pre-breeding, start of the breeding period, so that brings with it a fair amount of routine work. Blood sampling for trace elements, pre-breeding scanning. We'll have 3-week scans coming up soon as well, so a lot of that's kind of routine work, and then around that then we're fitting in our sick calls and things like that. But yeah, it's busy enough. There's a fair amount to get through still today.
So a common one with vets, Kieran, obviously, is how often are you on call? And how many people are in the practice, I suppose, is another way to ask.
So there's 10 of us in the practice. There's 8 full-time vets, 2 part-time vets. We have a 3 and 7 rota for the spring, so we tend to have 3 vets on call every night, first, second and third, and for that probably works out for maybe 3-4 months of the year, depending. Our springs are becoming more condensed and busier all the time in a shorter time frame. Yeah. So for the other 8 months of the year, we operate a 1 in 6 rota. So you're on 1 weekend of 6, 1 night a week, not on call the weeknight where you're working that weekend. You get a Wednesday off before your weekend on call, and you get a half day off the following Friday. So it's not too bad. This spring clinically hasn't been too busy. Animals get out we had a very, very dry February. Cows calved and got out to grass quickly. So we didn't see a lot of the LDAs and issues we would have usually seen. Maybe more RDAs, because cows went to grass so quickly after calving. We probably saw some more RDAs than normal. Again, because it was a relatively healthy spring, we wouldn't have seen a lot of issues with scouring calves and things like that. And where we did see them, rather than being an infectious disease problem, it was often more nutritional based or environmental based. So where the wind changed and maybe 50 calves in a shed started getting pneumonia or scouring, we might have seen a lot of that.
We were also talking about the adoption of more herd health plans and calf health plans to reduce disease. That's probably playing into that as well.
It is. So certainly as farmers become more proactive and people vaccinate more, anyone who builds a new shed now, they're built to a certain specification, so they know exactly how many animals can go in. Plus, when it comes to the stack effect, ventilation is better. So health of animals is just improving. The welfare of animals is improving all the time. So where we're dealing with issues now, we're dealing with maybe larger outbreaks or larger problems. So maybe an outbreak of mastitis where a herd has to come back indoors because of weather changes, not because there's a shortage of grass. There's never been as much grass around. But if you get a night like last night and you're on heavy ground, the cows have to come back inside. Cows are starting to display heat now, so the whole of the cows start to bull. You start to get a raise in cell count and clinical case of mastitis. So So we're dealing with those kind of problems. Again, we have issues with trace elements and cows going pre-breeding. So I was speaking to a farmer there earlier on, and he has an issue with phosphorus. So his cows are showing pica at the moment, so the cows are licking at ditches, licking at stones, and that's an issue that we'll have to rectify pre-breeding now as well.
Yeah. The final question, and we'll park this one at that then. There's a high adoption of collars in your catchment area and wearable technologies. I suppose, is that having a positive impact on, say, your day-to-day, or even when you call out to a
From
case?
a veterinary point of view, it is. So in some cases, we would probably have 40-50% of our clients now with activity monitors and collars on their cows. A lot of our farmers would, in one way it helps because the farmer gets alerted maybe earlier to an animal being sick, so we're probably called in earlier, which gives us a better chance to have a positive resolution. It's very good then, they're very useful, I suppose, pre-breeding, where we're getting cows highlighted that are non-cycling or having irregular heats, and as a result we're maybe able to take action with those cows to make sure that they're covered and bred within the first 3 weeks of breeding. So this is just a year and a half bullock, and he has just a case of pink eye infection. It's quite an advanced case, so we're going to give him 2 injections now, an antibiotic and an anti-inflammatory, and we should hopefully be okay. Possibly might lose the sight in the eye, but should be okay after that.
We're back here in the practice now. It's just after 4 o'clock. We had a very busy day. We're back after getting a bit of late lunch.
That's it.
Just before I let you go, because you have 2 more calls to get out to. One, XLVet and the grad programme, and secondly then, I suppose, how would you describe what it's like being a vet, or to young people maybe aspiring to be a vet, what to do?
So XLVets run a graduate programme. It's run by practicing vets. So for our new graduates, 1, 2, 3 years qualified. It's a 2-year programme. And it's got a module it's got various modules dealing with companion animal, equine, farm, and it really, I suppose, coaches you through, it solidifies the information that you've gathered as a student, I suppose, and when you're out in practice, it gives you kind of practical experience and the knowledge that those vets have had, the vets giving the course, practical experiences they've encountered, and how to deal with things. I suppose maybe more so the art of veterinary medicine than anything else.
Absolutely. And then typically, how many grads would you take on a year, roughly speaking?
I'm not sure now 100%. I think we're maybe in the region of 20 to 25.
Yeah, very good. So it's a good number there as well.
There is, and it's really good from a social point of view. It's great for new graduates to meet their peers, meet vets from other practices, swap stories. And we have a WhatsApp group for new graduates as well.
Good.
So we have a farm animal WhatsApp group, companion animal WhatsApp group, and a new graduate one. So the new grads then can chat away amongst themselves and swap stories and look for advice without talking to the rest of us.
Very good. I suppose finally then, before I let you go back out on the road, as a young vets aspiring to be a vet, I suppose what is the few things you want to tick off before considering it?
Oh, sure, look, I suppose it's important to see practice. It's important to know what you're letting yourself in for. But like as a career, it's a very rewarding career. Like it really is. You're constantly challenged by new things every day. You meet some fantastic people. You meet all different kinds of people. And if you're a mixed practitioner, you're inside. You're dealing with somebody that has a new kitten or a new puppy, and you see them right through till that dog is old and their children are heading off to college. And at the same time then, if on farm you're dealing with people's livelihoods all the time, like you're striving trying to make their business better and trying to improve the welfare of animals, and you're constantly being challenged. So it's a great career, like it really is, but it's not without challenges, and it's not for everybody. People need to know what they're letting themselves in for as well.
So try to get a little bit of experience if you can.
Try and get into practice and see know what you're doing.
Hi guys, my name is Danielle and I'm the Companion Animal Clinical Director here in Ormonde Veterinary Hospital. At the moment we're standing in our large animal shop, so this is generally our base for our large animal clients, our farming clients that come in and collect prescriptions, and our farm animal vets work from here. So I generally am not here, so if you want to follow me into the small animal section and we'll go through the hospital. Now, so we're in our companion animal hospital and this is our waiting area, Our clients will be met by our receptionist. Rosemary, our nurse, is on reception at the moment. So she is answering our phones and she's greeting our clients. We have 2 separate waiting areas, so we try to keep our feline patients separated from our canine patients, just to reduce the stress as they're waiting for their consultation. And once they're called in, we have a separate cat consultation room and a canine consultation room. This again reduces the stress. We know our cats are stressy animals, and we are a cat-friendly clinic. We're certified to a silver standard in that, so we want to make sure that we use free practices and keep everything as chilled as possible. My day starts at 8:30. Our nurses come in at 8 o'clock in the morning and they open up and then they treat all of our inpatients. So they'll do their rounds, bring our dogs out for walks and clean out our cat patients, and then they will get their medications ready. I come in at 8:30 then, and I give a look over all the inpatients, tie up anything from the night before. If there's been after hours calls or that, I'll check in with those and I'll get a handover from the vet that was on call the night before. Then typically our clinic with appointments starts at 9 o'clock in the morning and it runs through till 11 a.m. That can be anything from routine appointments, emergencies, vaccinations, you name it. This time of the year we have a lot of skin cases, so that kind of comprises a lot of our days. And then from 11 o'clock in the morning we do our surgeries. So if they're sedating Xrays, if they're bitch space, cat castrates, they all happen between 11 and 1. Hopefully they're all tied up by 1 o'clock and we can go for a lunch. Sometimes that doesn't happen. And then we come back after lunch and we look at our inpatients again at 2 o'clock. We touch base with all of our clients, give updates on our patients and how they're doing. And then between 2 and 6:30 we have our clinic. So in general, 2 to 5 is our afternoon clinic, 5 to 6:30 is our evening clinic.
And typically then, how many people work with you, say, in your team?
Yes, so we have a receptionist named Gemma, so she'll be on the desk, she'll answer the phones and deal with any of our client queries. And then we have 2 great nurses, so they will typically work between our nurse consults, so they'll do nurse clinics such as second vaccines, regular injections, nail clips, etc. And then we'll have a surgical nurse on for the day as well, monitoring anaesthetics, looking after our inpatients and keeping everything running out the back. So our team is compact. We would have vets that come in off the road and they do a clinic once or twice a week. It's nicely kind of spread out. I'm here Monday to Friday. I do some Saturdays as well. So overall it's nice and busy, but it's also varied, and we couldn't work without our nurses and our receptionists. They're as important as the vet.
Brilliant. Danielle, it's very striking when you walk into the practice, the high finish and professionalism to the building, but also the facilities. So do you want to maybe talk through the different facilities that you guys have here?
Yeah, we're really lucky here. We have super facilities. It makes our day-to-day job really, really easy. Where I'm standing at the moment is our surgical suite. So we have our gas anaesthesia, we have our locked cabinet with all of our important drugs, and we also have our X-ray machine in here. So this is an X-ray safe space as well. So we have our lead gowns, and we always make sure that we rotate our whoever is taking the X-rays from week to week, so none of us X-ray anything too much. We have our surgical table here and our surgical light as well. So yeah, this is the area where most of the important things happen. So the next room that we're in here is our lab room. So a lot of our diagnostics are processed here. Our nurses are really, really active in this room, and a lot of the work that they do happens here. So we have our microscope for our cytology, our fecal samples. We also have the oversight machine, which is a fecal analysis machine, which helps for selective worming and parasite treatment. We have our centrifuge. We have our X-ray machine over here, which processes all of our X-ray images. We have a super IDEX blood suite as well, which allows for in-house results and really fast results for our clients. So we make sure that our pets get the best standard of treatment that we can. And then we have our sterilizer for all of our equipment as well. So this dog presented yesterday, quite late and sore in herself. Weren't 100% sure what happened to her. There's a small bit of blood coming from one of the legs. thought she'd maybe got hit by a car. I'll show you our X-rays, but she's actually gotten shot. So we think that she might have ventured into the neighbouring field. There's quite a few sheep. There's a big flock of sheep in there, and the owner thinks maybe the farmer might have shot the dog. Now she's doing okay and she's stable, but it really just shows the importance of making sure that our pets don't go on into sheep flocks and that. So this is one of the X-rays that we took of the dog that had gotten shot. At this point we didn't know that there was a bullet present, but it all became clear when we saw the X-ray, so you can see one here. Now, and this is a second X-ray. Also 2 bullets visible on this X-ray, so if you can see up here, there's one right there, and one here as well. Most likely they're pretty superficial, they're not too deep or causing any problem to the internal structures, so we're going to leave them be and try and treat the pain and the inflammation associated with them first. So we also actually have a resident groomer here, Robin. So this is our grooming room, and as part of our grooming service, we offer a free health check with every patient that comes in, or every pet that comes in to be groomed. And this can be really helpful because you'll pick up on things that you might not see otherwise. Now, so this is our cattery. As I mentioned earlier, any of our longer staying feline patients would stay in our cattery, and that's also to reduce the stress of staying in a practice. So it's nice and quiet up here. We have some pheromone diffusers on as well, and they all have their own separate pens. They do get playtime during the day as well. It's a nice enclosed area that's safe, and there's not too many rafters that they can jump into. Yeah, but overall this is a really nice environment for cats to stay in.